Cancer is an abnormal growth of cells. There are over 100 different types of cancers. We have skin cancer, lung cancer, breast cancer, the list goes on. Symptoms vary depending on the type of cancer. Cancer is a very serious disease that may be preventable and curable. Cancer's treatment include the top three: chemo, radiation, and surgery. We all know someone who is directly or indirectly associated with someone going through cancer. More than 500,000 people are expected to die of cancer this year. Cancer is a condition of uncontrolled growth of abnormal cells. The body is made of trillions of cells. Normal cells, they tend to divide, make new cells, and die in that order. During the early years of a person's life, normal cells divide faster to allow the person to grow. After the person becomes an adult, most cells divide to replace worn out or dying cells or repair injuries. However, cancer starts when a cell in the body starts to grow out of control. Cancer cells grow different from normal cells. Instead of dying, cancer cells continue to grow into other tissues, starting something that the normal cells don't do, growing out of control to travel to the other parts of the body. This process is called metastasis. That happens when cancer cells get into the bloodstream or the lymph nodes. This is a diagram of normal cells. They all are even, lined up, and they begin to replace each other over time. However, this is a cell forming a tumor. As you can see, they begin to start to form together. They don't die out. They do not replace. They just keep building. Different types of cancer can behave differently. The term is being used both for medical conditions and tumor is malignant, and then we have benign. Both have very similar characteristics, however they are very different. Both are quite large, and both can be dangerous at times, and both can reoccur currently. However, they are different because of their rate of growth, their ability to metastasize, the site of the reoccurrence, and we also have the stickiness. Benign is very sticky. However, malignant, they are not, and they begin to float away to other regions of the body, and as well as the tissue invasion. In general, malignant tumors tend to invade nearby tissues, whereas benign, they do not. Though they may grow large and cause damage to nearby organs by creating pressure on them. Our lifestyle depends on how we may contract cancer. According to new findings on science.com, while genetics and environment are huge contributions to cancer risk, the simple decisions we make each day often matter too. Smoking, putting on sun lotion, our walking pace. Studies show the power of influence cancer is in our hands. We have to be mindful when partaking in certain activities. We must take care of ourselves if we want our body to take care of us. Healthy weight is a very big contribution to cancer. We must remain at a healthy weight. Smoking, of course, we all know is a very huge contribution to cancer, especially lung. We must stay physical. In order to be healthy in general, we must stay physical. If we want to lower our risk of cancer, of course, we must stay physical. That is very important. We often don't think alcohol is associated with cancer. However, if you want to lower your risk, no alcohol use or keep it at a very limited level. There are also 7 steps to prevent cancer. Do not use tobacco. It's summertime, it's right around the corner. Springtime is right around the corner. If we want to go outside, we must protect our skin. No one is off limits. A lot of people associate skin lotion and sunscreen with Caucasian. No, everyone must protect their skin. Of course, we have to eat a healthy diet, maintain healthy weight, and be physical. Safer sex and avoiding risky behavior is also a great way to stop or lower your chances of cancer. Get immunized. HPV and hepatitis vaccines are very important. We must educate ourselves. Our family medical history is very important, and we must get cancer screenings. All this information is available at preventcancer.com. Everyone's cancer is different, so everyone's treatment must be different. Of course, we have the treatment where it's laser cancer treatment. Laser is a very powerful way. Precise beams of light can be used instead of blades, scalpels, which are for very careful surgical work, including treatment of some cancers. Surgery is a very common is a very common treatment for cancer. It can be used for diagnosis, treatment or to prevent cancer in some cases. And of course, the most common is chemotherapy. It's used for medications or drugs to treat cancer. We also have radiation, and that is a high energy particle way to destroy the cancerous cells. And then we have targeted and immunotherapy, which are they're not quite common to cure cancer. So that is how to prevent cancer, and that is the education on cancer. It is up to us to get educated and to make sure that we do a good job to prevent cancer. Thank you.